USMLE-style multiple-choice questions focused on leprosy Hansen disease, covering the organism, clinical forms, pathophysiology, diagnosis, treatment, and epidemiology. Each question includes 5 answer choices and detailed explanations. Question 1. Pathogen and characteristics. A 32-year-old man from Brazil presents with chronic skin lesions and numbness in his hands and feet. A biopsy shows acid-fast bacilli in macrophages. Which of the following best describes the organism responsible? A. Obligate anaerobic, spore-forming rod. B. Acid-fast bacillus that grows well in culture. C. Acid-fast bacillus that prefers cool temperatures. D. Gram-negative diplococcus. E. Facultative intracellular rod that ferments lactose. Correct answer C. Acid-fast bacillus that prefers cool temperatures. Explanation? Mycobacterium lepra is an acid-fast bacillus that cannot be grown in vitro and thrives at cooler temperatures, hence affecting superficial tissues such as skin and peripheral nerves. Incorrect choices describes Clostridium spp, not M. lepra. B. M. lepra cannot be cultured in vitro. D. describes Neisseria spp. E. describes E. coli or other enterobacteria. Question 2. Clinical presentation. A patient presents with multiple symmetrically distributed skin nodules, loss of eyebrows, and thickened facial features, leonine facies. Which form of leprosy is most likely? A. Tuberculoid leprosy. B. Disseminated tuberculosis. C. Sarcoidosis. D. Lepromatous leprosy. E. Cutaneous leishmaniasis. Correct answer D. Lepromatous leprosy. Explanation. Lepromatous presents with diffuse skin lesions, nodules, and leonine facies. It is associated with low cell-mediated immunity and high bacterial load. Incorrect choices. A. Tuberculoid leprosy shows few, well-demarcated plaques. B. Disseminated TB affects internal organs primarily. C. Sarcoidosis causes non-caseating granulomas, not nodules. E. Leishmaniasis can mimic leprosy but typically causes ulcers. Question 3. Immunologic response. Which of the following best describes the immune response in tuberculoid leprosy? A. Th2 dominant response with high bacterial load. B. B-cell hyperactivity with elevated IgE. C. Th1 dominant response with low bacterial load. D. Defective TLR4 activation. E. CD8 plus T-cell dysfunction with neutropenia. Correct answer C. Th1 dominant response with low bacterial load. Explanation. Tuberculoid leprosy is characterized by a strong Th1 cell-mediated response, which limits bacterial proliferation, resulting in few lesions and low bacterial load. Incorrect choices. A. Describes lepromatous leprosy. B, D, E. Not relevant to leprosy's classic immune pathology. Question 4. Neurologic involvement. A 38-year-old man presents with hypoaesthetic, depigmented skin plaques, and glove and stocking sensory loss. What is the most likely underlying pathophysiology? A. Spinal cord demyelination. B. Autoimmune destruction of dorsal root ganglia. C. Direct invasion of peripheral nerves by acid-fast bacilli. D. Ischemic injury due to vasculitis. E. Neurotoxin-mediated inhibition of synaptic transmission. Correct answer C. Direct invasion of peripheral nerves by acid-fast bacilli. Explanation. Mycobacterium leprae invades Schwann cells, leading to sensory loss and peripheral neuropathy. Incorrect choices. A. Seen in multiple sclerosis. B. Seen in autoimmune conditions, e.g. paraneoplastic. D. More consistent with polyarteritis nodosa. E. Seen in botulism or tetanus. Question 5. Diagnosis. A 55-year-old immigrant from India presents with numbness in extremities and multiple skin lesions. Which of the following diagnostic methods is most appropriate to confirm leprosy? A. Blood culture. B. Gram stain of sputum. C. Skin biopsy with acid-fast staining or PCR. D. ELISA for anti-leprosy antibodies. E. Urine antigen test. Correct answer C. Skin biopsy with acid-fast staining or PCR. Explanation. Diagnosis of leprosy is made via skin biopsy showing acid-fast bacilli or via PCR to detect M. leprae DNA. The organism cannot be cultured in standard media. Incorrect choices. A, B, D, E are not useful in diagnosing leprosy.